Hello everyone and welcome back to the channel. If you're approaching 65 or already there, you've probably been swimming in a sea of mail about Medicare. It can be overwhelming, right? Today we're going to clear up a big piece of that puzzle, Medigap. We'll break down what it is, how it works, and help you figure out if it's the right choice for you. So, grab a cup of coffee and let's dive into the world of Medicare supplement insurance. First things first, what exactly is Medigap? The name itself gives a clue. It's a type of insurance designed to fill the gaps in original Medicare, which is Part A and Part B. Now, original Medicare is fantastic, but it doesn't cover everything. It has deductibles, coinsurance, and co-payments that you're responsible for paying out of pocket. Think of Part A, your hospital insurance. You have a pretty substantial deductible you have to meet for each hospital stay. And for Part B, your medical insurance, you typically pay 20% of the cost for most doctor services and outpatient care after you've met your annual deductible. These costs can add up quickly, especially if you have a serious health issue. This is where Medigap comes in. It's sold by private insurance companies but standardized by the government. A Medigap policy helps pay for some of those remaining healthcare costs, like your coinsurance, co-payments, and deductibles. So how does it actually work? It's simpler than you might think. When you have original Medicare and a Medigap plan, Medicare pays its share of the approved amount for covered healthcare costs first. Then your Medigap policy steps in and pays its share. For example, let's say you have a doctor's visit that costs $200. After you've met your Part B deductible for the year, Medicare will pay 80%, which is $160. You would normally owe the remaining 20%, which is $40. But if you have a Medigap plan that covers the Part B coinsurance, your Medigap policy would pay that $40 for you. Depending on the plan you choose, you might have very few, if any, out-of-pocket costs for Medicare-covered services. One of the best things about Medigap is the freedom it offers. You can see any doctor or visit any hospital in the United States that accepts Medicare. You don't need to worry about networks or getting referrals to see specialists. This flexibility is a huge draw for many people. Now, let's talk about the different types of Medigap plans. To keep things consistent, Medigap plans are standardized. They're identified by letters A, B, C, D, F, G, K, L, M, and N. Each letter corresponds to a different level of coverage. For example, Plan G is very popular because it covers almost everything that original Medicare doesn't, except for the Part B deductible. Plan F used to be the most comprehensive, but it's no longer available to people who became eligible for Medicare on or after January 1st, 2020. If you were eligible before that date, you might still be able to buy it. Plan N is another popular option that offers good coverage, but requires you to pay small co-pays for some doctor's visits and emergency room trips. This can make its monthly premium more affordable. The key thing to remember is that a Plan G from one company has the exact same basic benefits as a Plan G from another company. The only difference is the price they charge and their customer service. This makes it easier to compare plans based on cost. So, who is Medigap best for? Generally, Medigap is a great fit for individuals who want predictability and peace of mind when it comes to their healthcare costs. If you're concerned about potentially high out-of-pocket expenses from a sudden illness or chronic condition, a Medigap plan can act as a financial safety net. It allows you to budget for a fixed monthly premium, instead of facing unpredictable and potentially crippling medical bills. It's also ideal for people who travel frequently within the US and want the freedom to see any Medicare-accepting provider without network restrictions. If you have multiple chronic conditions that require frequent doctor visits or specialist care, the costs can add up fast. A comprehensive Medigap plan can significantly reduce that financial burden. However, it's not for everyone. If you're in excellent health and rarely see a doctor, you might feel that the monthly premium isn't worth it. Also, if you're comfortable with a managed care structure, like an HMO or PPO, a Medicare Advantage plan might be a better and often cheaper alternative. Let's touch on that, the big Medigap versus Medicare Advantage debate. This is a major decision point for many people. As we've discussed, Medigap works with original Medicare. You pay a separate monthly premium for your Medigap policy in addition to your Part B premium. In return, you get broad coverage and freedom of choice in providers. Medicare Advantage, also known as Part C, is an alternative to original Medicare. You get your Part A and Part B benefits through a private insurance plan. These plans often have low or even $0 monthly premiums and frequently include extra benefits not covered by original Medicare, like dental, vision, hearing, and prescription drug coverage, known as Part D. The trade-off is that you typically have to use doctors and hospitals within the plan's network, and you'll have co-payments and co-insurance for services. Your maximum out-of-pocket costs are capped annually, which is good, but that cap can be quite high. The choice really comes down to your personal priorities: predictable costs and provider freedom with Medigap versus lower premiums and extra benefits, but with network restrictions with Medicare Advantage. One of the most critical things to understand about Medigap is the timing of when you enroll. There's a special window called the Medigap Open Enrollment Period. This is a 6-month period that automatically starts on the first day of the month you're both 65 or older and enrolled in Medicare Part B. During this 6-month window, you have a guaranteed issue right. This means an insurance company cannot deny you a Medigap policy, charge you more, or make you wait for coverage to start because of any pre-existing health conditions. This is your golden ticket. If you miss this window and try to buy a policy later, insurance companies can use medical underwriting. They can look at your health history and they can legally refuse to sell you a policy or charge you a much higher premium. There are some special circumstances that might grant you another guaranteed issue, right? Like if you lose other health coverage. But for most people, that initial 6-month period is the absolute best time to enroll. Don't miss it. So, what about the cost? The monthly premium for a Medigap policy can vary widely based on several factors. First, the plan you choose. A more comprehensive plan like Plan G will cost more than a plan with less coverage like Plan N. Your location is also a huge factor. Premiums can differ significantly from one state or even one zip code to another. Your age and sometimes gender can also affect the price. And of course, the insurance company you choose makes a difference. As we said, benefits for a lettered plan are the same, but prices are not. Companies use different pricing methods: community rated, where everyone pays the same regardless of age; issue age rated, where your premium is based on your age when you buy the policy; and attained age rated, where the premium starts lower but increases as you get older. It's crucial to shop around and compare quotes from different highly rated companies to find the best value for your situation. Let's quickly recap the key pros and cons to help you weigh your decision. The biggest pros of Medigap are financial predictability. You know your major medical costs are covered, and freedom of choice. You can see any doctor that accepts Medicare anywhere in the country. It's simple to use, with no claim forms to fill out in most cases. The main cons are the cost. You have to pay a monthly premium on top of your Part B premium, and the lack of built-in prescription drug coverage. You'll need to buy a separate Medicare Part D plan for your medications. Medigap plans also generally don't cover routine dental, vision, or hearing care. So you have to weigh these pros and cons against your personal health needs, your budget, and how much risk you're comfortable taking on. To wrap it all up, deciding if Medigap is worth it is a deeply personal choice. There's no one-size-fits-all answer. Start by assessing your own health situation and how you anticipate using medical services. Think about your financial situation and whether a fixed monthly premium is preferable to unpredictable out-of-pocket costs. And consider your lifestyle. Is the freedom to choose any doctor important to you? My best advice is to do your homework during your Medigap open enrollment period. Use the official Medicare Plan Finder tool on medicare.gov. You can also contact your State Health Insurance Assistance Program, or SHIP, for free, unbiased counseling. They are a fantastic resource. Don't be afraid to ask questions and get all the information you need to make a confident decision about your healthcare future. Thank you so much for watching today. I hope this breakdown has helped demystify Medigap for you. Navigating Medicare can be tricky, but you're taking the right steps by educating yourself. If you found this video helpful, please give it a thumbs up and consider subscribing for more content to help you master your retirement years. Drop any questions you have in the comments below, and we'll do our best to help. Until next time, take care and stay informed.